Good afternoon, everyone. Hello and welcome to Alleviate's interactive session on muscle pain. As we all know, muscle pain is something which is very commonly presented to any of the pain clinics. We are no different. And usually, the muscle pain can be because of common causes. Like even after a viral fever, patient can have uh, muscle pain. It can be because of normal electrolyte imbalance. Muscle cramps can be there. Patient with rheumatoid, patient with any myofascial pain as such, or for example shoulder issues, knee issues. These the pain always exists, but specifically when what we also see is this pain is persistent over about a year. So the muscle, what we should understand is we have about 639 plus muscles in the body, all including your small muscles and all. So they have got a covering. So that is your fascia is there. They have got connective tissues, meaning they have got blood vessels supplying it, and there are fibers which are there. So involvement of all these things and disruption in the in this environment can always cause a problem if there is lack of blood supply to an area. If there is the muscle and the fascia are not sliding together. Fascia is nothing but that's the covering of the muscle. So anything which disrupts this normal, the harmony of these things can actually cause the muscle pain. So instead of me prolonging by giving an intro, maybe we can start with the interactive session and the questions, and I'll be answering them. Almaz, any questions are there?
Yes, doctor. So we got some questions from our followers or subscribers. So there are few questions. So we can get started in an order, doctor, so that
Please.
it will be easy for you to answer also. So
Yes.
the first question is that what are the causes that people like to know? What are the causes of muscle pain?
See, muscle pain, as I told you, it can be because of a patient has had a viral fever, for example. And post that also a patient can have. If there is any rheumatoid arthritis or any inflammatory problem in the body, the patient can have muscle pain. Micro trauma, continuously, if you're going to strain that area, for example, very commonly presented to us is IT professionals. They're sitting for hours together on their system. So their postures are not right. So even those things can cause pain over a long period of time.
Okay.
And if you have got hypothyroid, and patient is not taking any medicines, and that can also cause your pain. So certainly we should understand one thing is that muscles are a support system of the body. So any area, for example, if there is a disc bulge, still the patient can have muscle pain.
Okay.
So it can be it's again, we should not treat all muscle pains at a very superficial level. We should also understand one thing is these things are quite prolonged. If it is going here, we call it as a syndrome. Okay, myofascial pain syndrome. Usually after a period, about a year, it's prolonging. So that is the time when we actually tell it as a syndrome. So there should be something underneath also, or there should be a continuous insult or injury happening, which we need to actually pick up.
And the other question is related is that muscle pain can be referred or it can be a radiating.
Yeah, see, we get a lot of neck pain patients, for example.
Okay.
So neck pain and neck to shoulder pain. So usually they don't know if it's a neck pain or a shoulder pain. So there is a trapezius, this muscle, which is there in the middle, which it's there both. It starts from here and goes till your shoulders. This is a very, very commonly presented problem. So the patient, has pain over this area, and they are not able to tell if it is actually your neck pain or your shoulder pain also. Sometimes that pain does refer, to your upper hand also or the upper limb also. So it can be actually thought that is the pain actually coming from the nerves, because your cervical area or the spinal cord is here, your brain is here, and the cervical, the cord starts here and goes below. From here only your nerves to your hand are coming. So which you commonly see in disc problem, when the disc is bulged and those nerves which are actually coming get impinged or pressed upon, and the area which these nerves are supplying are going to get the pain.
Okay.
So it can be confused between by the two, but many a times these can be referred. it can be referred, see, the muscle is here, but it can be referred downwards.
Okay, okay. So with this pain, doctor, so how can this massage or manipulation help to reduce this pain? Is that
Very important aspect is stretching and
okay?
physiotherapy, which we have at Alleviate. We have got a dedicated team of
Okay.
about almost two physiotherapists, doctors at each of our centers. So our Jayanagar branch is also open. So we have a physiotherapy team, so which forms a very important aspect, and they work on this. It's not just the modalities. It's not the machinery which is involved or the equipments. It's about giving those stretches and manipulation, of course, as a stepwise approach. We as the pain becomes more chronic, the patient might not get relief only with physio, only with stretching, or only with manipulation. But manipulation and stretching are a very important and an integral part of the treatment of myofascial pain.
Yes, doctor. And the next question is related to nodes, doctor, or how was this nodes formed? What exactly these nodes are?
Nodes.
Yes, correct.
Okay, maybe they mean by triggers. So basically, okay, that's fine. So what basically happens is that within the muscle fibers, the taut band of this thing, you do get these hard, palpable areas. I think all of us would have experienced it, especially in the neck when you have a lot of pain in your neck coming from your muscles. If you're going to just slowly massage yourself, there will be these which will be painful.
Okay.
These are called trigger points. Again, coming back to your question before this, that can it be referred? Yes, that name also, it also gives you a hint into that these areas, when they are actually triggered, they do spread. The pain also spreads up and down.
Okay.
So these trigger point areas can actually be, it can be because of lack of blood supply to those areas, the capillaries which supply also. The pain can be generated in these nodes. And there are a lot of metabolic things, the changes which are actually happening within the muscle, which actually cause the pain. And these trigger points can be about, there are two types of them. One is without you actually handling them or touching them or palpating them, still they'll be painful.
Okay.
And a few will be painful on palpation alone. So the ones which are painful even without you touching, these are called your active trigger points. The one which you press upon and then you get the pain and elicit it. So these are all your latent ones. Yes.
Yes, doctor. So, what are the treatment, doctor? So, one question is related to how Botox treatment can help on this. So,
there are multiple treatments which can be done for a trigger point. First thing is diagnosis. Getting to a diagnosis of which area your pain is coming from. So that's very important. At Alleviate, we believe in having good history taking and a physical examination, which is the key, because you need to pick up from where the pain is coming. Diagnosis is very important. And in physical examination, ultrasound examination also plays a very important role. How do? You scan it, you scan the area, you pick these small muscles. For example, neck, there are so many muscles which are very small and thin, and it's practically impossible to actually locate or see them with your naked eye. So what we do is we scan the area, we see from where it is, we do a sonopalpation, which we call, that is under the ultrasound guidance, we actually palpate and see if that area is triggering the pain. So once we have got that in our hand, after that there are multiple things, like slowly start off with, if it's very acute, then we do our dry needling, we do our wet needling. We can do a needle and put some local anesthetic in those areas and mobilize them for physiotherapy, long-term physiotherapy, which consists of your manipulations, your stretching, and we have got something called as Astro also available, and our physiotherapists are very well trained in that. So these are the things initially which we can do. Then, as you asked me, Botox, botulinum toxin type A can be actually given into those areas. So just to stress upon a little points, these areas there will be depletion of ATPs, lack of blood supply. Then there can also be increase in some neurotransmitters. So these areas are all blocked by your buttocks.
Okay.
So again, the pain relief can be for quite a long time, but post which the thing which is actually helping the patients is after you have injected and given the patient the relief, when they actually start the normalizing their biomechanics. So mainly a patient has got pain here, he's always like this. You see, so once he starts his activities, normal activities, during that phase, that improvement happens.
Okay.
That's very important. See, what we should understand is one more, just out of the box. One question which most of my patients ask us is lumbar support belt helpful? Of course, it's helpful, but it is only for those days when the pain is more, but not on a prolonged basis.
Okay.
What happens, I always give this example to most of my patients, is that when we actually get a fracture of our hand, for example, a small fracture. So what do? We do, go to a doctor and he sees, he does an X-ray for us. After that, we put a plaster. We keep the plaster depending about 6 to 8 weeks. Have you noticed that after removing the plaster, what is the condition of both the hands? Is there any difference? There's always a difference. There's a difference, or that the hand which you put a plaster on will be thin. So because for the 6 to 8 weeks, you have not used those muscles. Okay, similar to even if you see, paralytic limbs, paralysis, no, for people who have had paralysis for a long time and they've not used. When they've not used, the muscles around that area also become weak. Okay. So similarly, in this also, when lumbar support belt is put, the muscles around those areas become weak. Your body starts to becoming dependent on the belt.
Okay.
It's not good.
Okay.
So that is why you have to activate those muscles. So when you have given any sort of treatment, whichever I have told you,
okay,
we also do prolotherapy, like a very natural way of healing. The thing is, we do put some dextrose, sweet water, all of us have it in our body, with some local anesthetic. We mix it, and with a very small thin needle, which is so thin that it doesn't enter the, something like an acupuncture needle. We just enter and we see it in the ultrasound. It's very neatly and nicely seen.
Okay.
So that there is precision and there is safety also. So we insert the needle to that area and we do inject about 1 ml a distributed area. And of course, you're injecting something which is very natural to the body, isn't it? Okay. So it helps in, the diluting the pain. And there is a sensitization also, which one of the cause which, there is something called as fibromyalgia. See, you will be getting patients who will have pain from top to bottom. Will have both the shoulders are paining, severe pain. It's not that their pain is not real. It is real. It is just that I give an example to all my patients that if there are 4 or 5 people sitting in a room, okay, and we have a needle of the same size, and I prick the same needle for all the people, do you think everyone will get the same pain?
No.
Yeah, pain will not be the same. It is very subjective. It is different for different. Some people might be very, very sensitive. You just touch and it pains. It's not that but the sensitivity of the body. This is the same thing which happens in fibromyalgia. Okay. Where again, a patient has myofascial pain all around the body. So we do treat fibromyalgia also, by the way. Okay. So that is also one of the cause of, pain. Okay. So, yes. So Botox, yeah, we do treat Botox.
Okay. And one more question, doctor. Is this muscle pain and nerve pain same, or what is the difference between these two? How we can differentiate?
Again, this is the basic of any pain. There are 2 types of pain which can originate. One is, for example, I'll explain it in a very simple way. I've got I go to a gym and I have pain. I can point out that pain. Okay. It's paining. This is a muscle pain. Okay. The same thing is we get hit in this funny bone. We get hit in near the elbow, funny bone. We feel like a current shock, isn't it?
Correct. Yes.
So that is a nerve-related pain. So the pain is there, but you don't know from where it is coming and where it is going. Okay. No? So there is a difference between the two. So similarly, nerve-related pain is totally different, but they can exist together. It can be so that the patient, for example, has had a disc prolapse. Okay. Back. Okay. And that is radiating to his leg like a current shock. But he also has got muscular pain because, for example, this is the spine. This area, there is a disc bulge, for example. Okay. So the body tries to protect that area by tightening its muscles. So that is why the patient will also complain of back stiffness or spasm.
Okay.
That is just a compensatory thing where the body is trying to protect that area. So the myofascial pain and nerve related pain are existing together in this scenario.
Okay. Okay. Yes.
Okay.
Yeah. So, and one more question, doctor. You asked about the trigger points, and one more question is related to tender points. So, can you just explain?
Tender points are seen in fibromyalgia.
Okay.
Okay. So trigger points are seen in this one. But again, that was a diagnostic criteria. Before that, you had to have so many tender points. Only then can you be diagnosed as a fibromyalgia case and all that. But that's not there now. It's all about the history and what the patient gives us. We treat on the basis of that only.
Okay.
Yeah.
Yes, doctor. So we are done with the questions, and yeah. So just to conclude, doctor, what could be the main two reasons for this muscle pain? If you can just.
There is no 1-2 reason for this, as I told you. So, for example, back pain. So muscle pain can be at any point. For the, it's not just the neck, but commonly we see it as neck. Okay. This is basically because we get a lot of IT professionals who have come and, I'm also treating a, metro, for example, metro driver. These people are standing there, continuously, where your shoulders are completely on this, it's hanging on the trapezius muscle. So such people will have a lot of complaints. So one more thing is the ignoring muscle pain is also not right. I keep telling them that there could be something deeper. So you treat the muscle pain, start off with step-by-step approach. So many a times when you treat only a myofascial pain, it gets sorted out. But as I told you, it could be something deeper as well. There could be something wherein you have to investigate and see. So similarly, back pain, for example, you have paraspinal muscles, meaning muscles around your back. Okay. So if a patient comes to me with sudden severe pain, deep seated in the back, that back pain is not radiating down to the leg. Okay? And the pain increases when the patient is sitting, for example. Okay. Patient is quite young. So what other causes we have to rule out? Many a times, even you doing the higher modalities, you getting your investigations done like MRI also might not give you the diagnosis. Many a times. Okay. So in this case, the history which I'm telling you is my suspect should go on deeper muscles of the lower back. Okay. Something like QL. So that could be the cause of the back pain. That could alone be the cause of back pain. So these are all the things which we have to be very, and one more thing is muscular pain in athletes, in sports injuries is also something which you have to actually concentrate. So recently a player, a javelin thrower, javelin, again, this is intensity is more, you require a lot, although these people are quite, powerful and they're very prepared and all those things, but still they do have a lot of injuries which are happening. So you have to, the patient was having pain for almost 3-4 months, and it was inside part of his thighs, and thighs are quite an area which has got so many muscles, largest group of muscles in the world. And such places also, so we had to evaluate and see for it which area it is. And he had a very small, there is a small muscle which was actually partly torn. Okay, that's because he was showing me a video of what had happened. And that area. So such things also do present. If the tear is not more, you can treat it. We do regenerative therapy, we do PRP, stem cells. So all those things can also be done. Pain related blocks, all these things can be done. If the patient is coming with, back pain radiating to his leg, we do epidural injections, which many a times avoid your surgeries. Or depending on what finding it is, we don't treat MRIs, isn't it? We are treating the patients here. So at the end of it, it should correlate. It's not that there is a small bulge in the neck and you need to get a surgery done. It's not like that. So these things help in actually getting to the point, getting to a diagnosis. So it can be a diagnostic injection, it can be a therapeutic injection, which will actually help in treating. So your just to conclude, myofascial pain, start off by treating and see how it is. This is something which can be present over about a year also. And more. Only after that do we actually get them together as a myofascial pain syndrome. And if they are not responsive, treat it stepwise. And treat the root cause. That's the most important thing.
Yes, doctor.
Yeah.
So, yeah. Thank you for answering all the questions, doctor.
Yeah. Okay.
Okay, fine.
Thank you.
Thank you, doctor.